Thanks, Amir, for the introduction, and welcome everyone to today's webinar. Let me just get to share my screen. Amir, can you just indicate to me that you can see that?
I can, it's not on presenter mode. There we go. Now it's on presenter mode.
Okay. Let me just, for everyone's bandwidth, now that I'm in presenter mode, I can't get to my, let me just switch the camera off so we save on bandwidth. Today's topic is about Cochrane clinical answers, and together we're going to explore an overview of Cochrane clinical answers, what's the process behind the scenes, and how can we use it. So first we're going to look at an overview of CCAs, and then we're going to do a short demonstration. So Cochrane Clinical Answers provides a concise, evidence-based answers to clinical questions based on Cochrane reviews. It is actionable and it helps healthcare professionals, health science students to make point-of-care decisions in practice. It follows the PICO approach, where P stands for population or patient, or people. I stands for intervention, the C for control or comparison, and the O stands for outcome. And it is quality controlled by editor-in-chief, who's also a member of the Cochrane Library editorial board. So there are various ways to search in the Cochrane Library. There's a simple search box, which I'll just demonstrate for you in a minute. There's an advanced search function, which we usually use when we conduct searches, in-depth and comprehensive searches for systematic reviews or scoping reviews. And then you can also browse per topic or date, which I found often is very useful and people's maybe first choice. So this is a screenshot of all the products that were in the Cochrane Library last month when I took the screenshot. So if you want to see what everything is, you can just use this simple search box here, and you put in an asterisk. That's Shift 8 on your keyboard. And then you will see various tabs of the various category of products that you can see in the Cochrane Library. So I looked this morning, and in a month, we've already exceeded 9,400 Cochrane reviews. Quite a lot of protocols are underway, loads of trials, editorial special collections, and then there at the end, you can see the number of clinical answers that's in the Cochrane Library. You can filter for these by choosing a certain publication date or a specific topic. For example, in child health, you can see there's about 1,120 products in the Cochrane Library. So what is the process in terms of how Cochrane clinical answers are being selected or being put together? Based on which Cochrane reviews do they decide, is there a need for Cochrane clinical answers? So generally, there's 4 criteria that they follow. The first one is generalizability or relevance of the review question. The Cochrane review needs to address relevant questions that is relevant for decision-making for healthcare professionals, and it must have a wide audience. It mustn't just be for a specific setting. It must have, relevance for a wider audience. Then the search date is also an important criteria. They won't use Cochrane reviews that are older than 5 years old. So they will choose Cochrane reviews of which the last date of search was within the last 5 years. Then they also look at the volume of evidence in the review. There needs to be sufficient evidence that one can use the evidence to make to draw conclusions that are relevant for practice. Sometimes there are reviews that have quite large amount of evidence, and often it's difficult, for readers to sift through the large amounts or large volume of results. So a Cochrane clinical answer will be then a good product to help tease out the various subsections of the questions and the evidence that goes with each subsection. So volume of the evidence is another criteria that they look at. And then there's also, they look at priority reviews or high profile Cochrane reviews. So those, in preparation for this session, I went, let me just see if I can share the screen. Here we go. So drawing on AI and Google to help me to look at a nice succinct definition for what is being seen as a high priority Cochrane review. It's those that identifies particularly important and in need of focus, often due to factors like the high burden of disease, potential for significant impact, or the need to address gaps in existing knowledge. Often those are also reviews that directly feed into clinical practice guidelines, such as for WHO, for example. So those are what I refer to as priority reviews. And then they also said that regardless of the other three criteria, if there is a priority review, it takes it gets preference for a clinical answer, a Cochrane clinical answer to be produced for that high priority review. So each Cochrane clinical answer is based on a single Cochrane review, and each Cochrane clinical answer is being done by an editor and a practicing physician or other relevant healthcare professional in the field, such as a physiotherapist, for example, depending on, of course, the actual question. Most CCAs address the same clinical question as the Cochrane review, but there can be some exceptions, especially if the Cochrane review addresses a broad topic. CCAs are updated in response to any updates to the Cochrane review on which they are based. And the far majority of Cochrane clinical answers are based on intervention question reviews that report results of pairwise meta-analyses. In other words, not network meta-analyses. Although there are some clinical answers that's also based on reviews on where there were network meta-analyses. When it comes to other types of reviews, Cochrane clinical answers are also being produced, although not on the same large scale. And that's when the editor team, they manually extracts the data. So it takes a bit longer to put those together. So on this slide, I thought it's just nice to check in and look at the various categories of types of questions in healthcare, because we've just been referring to intervention type of Cochrane reviews. So here you can see all the other types of categories in healthcare, such as diagnosis and screening, prevalence or incidence or occurrence, as it's also referred to, risk factor questions, questions on harm, prognosis. Then you will see that there are two categories of intervention questions, either where the focus is on management or treatment of a condition, or otherwise to prevent a particular condition. We also get questions such as cost effectiveness, and then also the more qualitative type of questions speaks to people's experiences and meaning. For example, why patients behave in a certain way. And we also know that in the Cochrane Library, there's quite a number of qualitative evidence synthesis where, questions on experience and meaning in healthcare have also been investigated. So if you are interested in the other types of questions too, on the website, and also on my slides, which can be shared afterwards if need be, you can click on the link and it will tell you how the editorial team goes about to produce Cochrane clinical answers on reviews where there's network meta-analysis, qualitative evidence, where the question is on diagnostic test accuracy, And there's also living reviews that, especially from the COVID era, became very useful and important. So what the Cochrane Clinical Answer boils down to, and is specifically, it provides you evidence about whether there's a clinically significant difference that the intervention can lead to. So in the Cochrane Clinical Answer, it will quantify the effect size of the intervention for each outcome. And that will be in terms of the average absolute effect. So they express it in the number of people per thousand people with a certain outcome of interest, or then if it's a continuous outcome, the mean difference. And then the units such as, kilograms, if the continuous outcome maybe is weight change, or millimeters of mercury, if the outcome maybe is blood pressure. Then the Cochrane Clinical Answer also includes statements reflecting the strength of the evidence, the certainty of the evidence, and or the reliability of the evidence. So it gives us a nice, takeaway message in terms of the strength, the quality of the evidence that speaks to the particular question. The answer also aims to put the question into clinical context, draw conclusions, and highlight the uncertainty. And then also it's important to point out that the Cochrane Clinical Answers are reviewed and peer-reviewed a lot, and also to make sure that they adhere and are in sync with the relevant guidelines. If you are a practicing healthcare professional and you would like to get involved in producing a Cochrane Clinical Answer, that's also possible. You can reach out to them. They will ask you to send your CV, and you can also get involved in that way should you would like to. Right. Let's move over to a demonstration. So let's say you are a fourth-year medical student in your obstetrics rotation at a training hospital. Your first patient is pregnant. She is at 30 weeks gestation with a history of previous preterm birth at 32 weeks. She's experiencing frequent contractions and the cervix is showing signs of progressive dilation. Your clinical supervisor tasks you with finding out whether magnesium sulfate should be given to minimize the risk of cerebral palsy in the infant. And if so, what should be communicated to the patient about potential adverse effects of the magnesium sulfate? You need to provide an evidence-based answer quickly. Okay, so this scenario states an area of uncertainty for you. So what do we do when we encounter uncertainty in healthcare? So we follow the evidence-based healthcare approach. And evidence-based healthcare speaks to the integration of best research evidence with clinical expertise and experience and the patient's values and preferences. The main aim of evidence-based healthcare is to improve patient outcomes. So that's why it is, a very relevant approach to address uncertainty when you come across it. And there are three important principles which underpins evidence-based healthcare, and they are included in the definition from Dave Sackett et al. And they are, it's a merge between looking at the best available clinical evidence, also taking into account the specific healthcare professionals' experience and expertise, and then also merge with the values and expectations, the culture, the preferences of the patient itself. And those three things together help us to improve patient outcomes. So the evidence-based healthcare approach consists out of 5 A's or 5 steps. The first one is you take the uncertainty and you convert it into an answerable question. Secondly, it's to search for the best evidence to answer that particular question. And then thirdly is to critically appraise the evidence, to look behind the quality, to look at the quality and to decide to what extent can we believe the findings of the results of this best evidence. Then the fourth step is to consider application of the best available evidence together with a lot of other considerations such as resources, staff time, the health system, logistics, ethics, stuff like that. And then once you have made a decision and have decided how you're going to care for your patient in this uncertain context, you also stand back, take a step back afterwards and evaluate how did it go, was your decision the right decision, how can you improve it for the next patient. So those in a nutshell are the 5 steps of evidence-based healthcare. So the next thing that we need to ask ourselves when we encounter uncertainty is what type of question are we dealing with, right? So when we look at our summary table again of the different types of questions, we see that in this case, a treatment intervention question is the question that we are dealing with. We have a woman in preterm labor, which is the P of the PICO. The intervention that we are looking at is magnesium sulfate. The control, the comparator, would be usual care plus maybe a placebo. And then the outcome, particularly that we are interested in this scenario, is the incidence of or the occurrence of cerebral palsy and adverse events. But of course, in this decision, there's a whole lot of other outcomes that's also important to take into account. So if we put the PICO elements together in a question format, we would say in pregnant women at risk of preterm labor, what are the effects of prenatal magnesium sulfate compared to standard care or placebo on cerebral palsy and adverse events? So that is then step 1 of evidence-based healthcare. Step 2 of evidence-based healthcare is the searching. So we want to search for best available evidence to answer the question. So we know that there's quite a range of databases and sources that we can consult in terms of identifying the best available evidence. And the Cochrane Library is one of the best, is perhaps the best source of answering questions on intervention questions, specifically intervention questions. The Cochrane Library is a key source. And then maybe another source to look at is PubMed, which is available for us in South Africa, easy to search. But the Cochrane Library is included in PubMed as well. Those sources are both good sources for us to search. But the more specific source that won't come with that much noise is the Cochrane Library. So that would be my first go-to source to search. When we approach a search in the evidence-based healthcare approach, we also look at the PICO elements and decide for ourselves what PICO elements do we want to search for, because one can keep the search as simple as possible and aligned with the purpose of our search. So if we are doing a search for the purpose of identifying eligible studies for a systematic review or scoping review, for example, we will go out of our way to design a very comprehensive, a very exhaustive search, searching a lot of sources. But when it comes to clinical practice and us needing quick answers as a healthcare professional or as a healthcare student, searching the Cochrane Library in a simple approach is sufficient. So in this case, the most simple search would be to go for the intervention, which is magnesium sulfate. So let's have a look and we see what happens if we search for magnesium sulfate in the Cochrane Library. Just want to get to my browser. Here we are. Right. So you simply Google Cochrane Library, and the first, the first site that comes up will take you to the homepage of the Cochrane Library, and it looks like this. So here on the top right section of the homepage is the simple search box, and if we type in our intervention, see what happens. Right, we can see there are 49 Cochrane reviews that is about magnesium or magnesium sulfate. One protocol, which means it's a project that's underway, quite a number of trials, and then we will see 6 clinical answers. So let's have a look there. So one can make the search a bit more specific. For example, say magnesium sulfate and cerebral palsy is a specific outcome that we're looking for in this case, right? But in this case, 6 is few on it's a small number of answers or of results, so it's easy to sift through and to identify which one is the one that speaks to our question the best. So if we screen through, we can see that this one, number 3, for women at risk of preterm birth, what are the effects of prenatal magnesium sulfate on maternal outcomes and on infant outcomes extending into childhood? So in this case, this clinical answer looks like it's giving us the exact answer that we're looking for. We can see when it was produced. We can click here on the right-hand side. We can go to the original Cochrane review on which this clinical answer is based. And on the top, it gives us the bottom line. Magnesium sulfate given to women at risk of preterm birth reduces the rate of cerebral palsy in their infants up to 2 years of age. However, it likely increases the risk of maternal adverse events, some severe enough to stop treatment. So those are ones that we would then like to go and have a closer look at. So the Cochrane clinical answer is almost like a mass media report where the bottom line is given to you first, and then as you work through the rest of the article, you will get to the more detail. So here we can see the comparisons. So in this case, in this Cochrane clinical answer, there's only one comparison, magnesium sulfate versus placebo. And then it lists for you all the various outcomes that were seem important for clinical practice and also that were investigated within the Cochrane review that produced this evidence for us. So if we click on the one that speaks to our scenario the most closely is cerebral palsy, you can have a look here, and it also shows you the relevant statistics, the meta-analysis that gave rise to the specific evidence. So we can see here that a risk ratio was used, and overall, on average, it showed about a 30% reduction, which favors magnesium sulfate when compared to placebo. So definitely a favor there. And then the Cochrane review would have done the grade summary, the grade judgments with regards to the quality of evidence, and that is how we got to this high quality, high certainty evidence that's been referred to here. And then, of course, like I said, when you make a decision in practice, it's not only one outcome that you're looking for, you're also looking at other outcomes. So we can have a look here at the maternal side effects. And you can go and read the detail with regards to those for different hypotension, tachycardia, mouth dryness, nausea, vomiting, all sorts of other ones. Let's get back to my slides. Oh yeah, something that I wanted to point out to you here. You will see that in the scenario, magnesium sulfate was spelled with a PH. And that's also the term that I used when I searched this particular spelling. However, when we search, we got to the clinical answer that has magnesium sulfate spelled in a bit of a different way with the F instead of the PH. So I want to point out here that the search engine automatically picks up these spelling differences, UK versus American spelling, for example. And that applies to other search terms as well. So we've already spoken through that. And then here I just wanted to highlight again that the Cochrane Clinical Answers incorporates for us the first 3 steps of evidence-based health. Oh, I should, sorry, put it back here. Incorporates for us the first 3 steps of evidence-based healthcare. So it leaves then the clinician or the healthcare professional with considering, the provided content for steps 1 to 3 to consider applying the evidence to your patient or your scenario. Right. So that is what I have been preparing to show you. We are quite ahead of time, and we can open the floor for questions and for discussions.
Thanks, Anna, for the presentation. I see there's one question in the chat. It says, please, can you demonstrate how you would add the filters for the search?
Sure. I just want to open my browser again. So let's look at from, oopsie. Let's start from the beginning again. Go to the Cochrane Library. And if you want to go straight to clinical answers, you click there on Browse Clinical Answers. It will automatically add the asterisk and show you all the clinical answers that there are, right? Now here, the filters on your left are either date-based or topic-based. So say, for example, we know it was a child health topic. And we were interested in clinical answers in child health that were produced in the last year. And we click on that filter, and that adds to the child health filter, and then it brings us to 22. So now you can, so if for example, you're working in child health, we can even further link this now under, it provided us with subcategories now, how this 22 clinical answers on child health that was produced in the last year are split up. So we are interested in the neonatal care. So we should find our Cochrane clinical answer among these 6. See. Let's have a look here. Even though it was broken down on this side, it doesn't seem now to go through on this side. I don't know, Amir, if you have any ideas of what happened here now. It seems like the filters on the right didn't pull through. On the left didn't pull through to the answers on the right, even though the numbers are on the left pointing towards the correct numbers. Yeah, that's now some Murphy's law that's being present here. Let's try something totally different. Thanks for that, Karina.
Pleasure.
Let's see if that works. I missed the apply button.
I hope it works.
You should just, try this. Let's start again. Let's see. Go to clinical answers. It automatically adds the asterisk for you. On the left, we choose, let's say, the last year. It's 125. Child health is 22. Apply. Ah, I'm wondering if we can always just choose this. Let's see if that will work. Let's say now we have 106 clinical answers here. We now choose neonatal care. Shows the 137 here. Right. So I think, yeah, this big amount here is just a little bit confusing, but I think it's because that is still there. So here you can now screen if your field is neonatal care, for example, you can now screen through these results. But let's also look at a different example. Let's start again. So obviously here in the simple search box, there are various field tags that you can use. So often the one that we most often use is the title, abstract, and keyword because it's the most specific one. You don't want your term just to be mentioned by the way in a discussion section or a background section of the review or the clinical answer. You want the clinical answer to be about that particular intervention, for example. So let's look at metformin as an example. Right, so for metformin, there are 51 Cochrane reviews. And then I'm still getting to answer the question about using the filters. So here we can, let's see if it works. If we, for example, we can see out of the 51 Cochrane reviews on metformin, we can see 48 are intervention questions, and there's actually 3 in overviews. So metformin is such a versatile drug, and often it's used for quite a number of different indications, and the overview is often very useful to provide either an overview of different treatments or different ways that a treatment can be used and can be useful for various conditions. So in this case, there's one on gestational diabetes. There's one on the prevention of OHSS and another one on gestational diabetes. So that filter then at least worked well. So let's take see if you want to take the filter off, you click here on the on the cross. Right. Now we're again back with the 51 Cochrane reviews on metformin. If you want to limit it to bottom line clinical answers, you can have a look at the 12 that they've got here. And if we are only interested in, let's say, ones that are relevant to gynecology patients, yeah, now the filtering is working. So now we can see the 4 clinical answers on metformin that is relevant to gynecology. Right. Okay. I hope that answers your question, and I'm glad we've sorted it now. And if you want to broaden your topic again, you simply click on the cross. Right. Okay. Further questions?
It's another question.
Comments?
Can you reference a Cochrane clinical answer in an article, or should you rather reference the article used to generate the answer?
That's a good question. I recall that, let's have a look.
I guess it also depends if the
For
if
the
the clinical
purpose of,
answer is referring to the original article, if they're using, like, if they're using their own views or interpretation.
Amir, hi everybody. This is Mark. It does say cite the answer there on top, on the top right. It gives you a click there for cite this answer.
yeah. So now you can just you can decide in which software you want to export it to, or you can just copy and paste it here.
Yeah, and then that will generate what that the citation will look like. Yeah.
No, thanks. Thanks, Mark. Yeah, I guess it also depends on for what reason you are referencing the content. If you're
Yeah, but I think it does make for easier reading, as was mentioned there, like, for somebody who's going to read the article where you've referred to this, rather than to cite the original Cochrane review, which could be quite a lot of work to go through. It will actually help, I suppose, to be able to just look at the clinical answer. Yeah.
Yes.
Yeah, thanks.
Sure, Sandy. Yeah, I'll send the slides to Benny and Lorenzo, and he can circulate it to you.
Right.
Mark and
checking the
Amir, are there
chat.
any other features that you think we should explore here, or maybe show or have a look through? Or maybe I can ask. Yes, I see your hand is up, Andre.
Seem to be like three-step, like, how would you, if you're thinking of the question in a different way, can you put that, that question in somewhere and let it answer it? And then also I just wanted to find out about, like, is this the right platform? Like, if you're thinking about, like, what, like, clinical tests you want to ask, like, requesting whether you should request a CT scan or an MRI, or is this the right platform for such a question? Thanks.
Amir, could you hear Andre? I could not hear him very well.
Not on my side. Mark?
No, unfortunately, it was also quite warbled. I don't know. Andre, do you mind trying again, or maybe putting
Or
the
typing
question
in the chat?
Hmm.
Sorry about that, Andre. We're just struggling with the audio. While Andre is maybe typing his question,
Sorry,
there
can
was
you
a
hear me now?
question.
Much better.
Yes, much better.
Sorry, I don't know what. I think it's the rain. It's raining terribly where I'm at. I just had to put in some headphones. What I was asking is that, is this like two questions? Is one is that the question seems to have been like pre-asked, but if you know, were thinking of the question differently, is there some way of like you know, putting that into the keywords or something like that? Because maybe you're not thinking the same way that the question has been formulated. And then secondly, I just wanted to find out, is this the right platform if you were asking like a question, not so much like treatment, etc., but maybe like investigations, and if you wanted to know like whether you should request a CT scan or MRI or what type of blood test you needed to request, is this platform useful for that? Thanks.
I am not the best person to answer your second question, Andre, but I can speak to your first question. Do you have an example for us that we can work with? Because his first question was about, you know, obviously when I prepared it, I looked at what clinical answers are available so that my scenario is linked to a clinical answer that's in existence. And sometimes, like, and even though we are doing simple searches, focusing on, maybe in this case it was the intervention component of the PICO, it brought me directly to the clinical answer. But sometimes one would need to dig a little bit. So maybe, Andre, do you have an example for us that we can use that?
I can't think off the top of my head, but like, you know, say for example, like this question that you have up here says like, for women who are obese during pregnancy, it has form and improve outcomes. But if I if I wasn't thinking of the question like that, if I, for example, it's like, oh, should I use insulin or should I use metformin in the treatment of the patient? But like, it's a sort of like either or question, and like, would I have to search something for insulin, something for metformin, or you know, I don't know if that helps, but like,
No, that does help. Thank you. So if we go back to our PICO approach, right? So, and if I go back to here, so the first step is to acknowledge that you have an uncertainty, right? And everyone encounters uncertainties like on a daily or weekly basis, right? Then you need to think for yourself, what is the type of question? So in your case, in this example now, it's also an intervention question. You're thinking of what intervention to use for this particular patient. And then we go to step one. So these are kind of the behind scenes steps of evidence-based healthcare. I call this step 0. Identify the uncertainty and what type of question is it. And then we move over to the PICO approach. So firstly, you will break your uncertainty down into PICO elements. Okay. So here in your case, you could have insulin or metformin or what you know, maybe lifestyle or whatever the relevant let's say contestants or options are, right? But you need to be specific on what is your type of patient, and what is it that you are looking for, right? Sometimes the I and the C is interchangeably or goes hand in hand. So if you have your question or your uncertainty teased out for yourself in this format, it's easier for you to go to step 2 and to identify what is it that I'm going to search for. So
because I don't know, but I don't know if it's actually.
but I hear someone is speaking. I'm not sure if it's speaking to me. But let's continue with Andre's example. So Andre, in your scenario now, were you talking about the diabetic patient? Because or a obese patient, or because in that case, not knowing exactly what intervention you want to use, instead of searching for how do I get out of this? Instead of searching for the intervention itself, like magnesium sulfate or metformin, you would be able then to search for a different pico element. So I search for the eye, but you will then instead, for example, focus on the participant pico element. So instead of typing in metformin or magnesium sulfate, you will then, for example, type in obesity or obese. So if we do that, then you can see that there are 30 clinical answers that speaks to that condition. And now you can use these subtopics on the left to narrow down this 30 results. So for example, if it was that you're worried about the patient's heart health, or if it was a child, or there was an endocrine issue, or even a public health issue or kidney issue, you can click on the various filters, and it will limit you to the clinical answers that speaks to that particular question. Andre, does that help?
Yeah, thanks. That helps a lot. Thank you.
So the bottom line is, go to your PICO question, look at your PICO elements, and decide which of these PICO elements makes most sense to do a simple search with. Okay, Amir answered the question about the recording. There is a recording, and there is a link for it on YouTube. Is there any other question that I missed, Amir?
I'm looking at it. Doesn't look like it. Looks like we're quite up to date with it.
Great.
Looks like
Anyone
we're up
that
to
wants
date.
to raise their hand and ask another question or related question?
Sorry, I was just wondering about the second question about the investigations. If this is the right platform to inquire for what's an appropriate investigation for a patient. Thanks.
So that speaks to diagnostic test accuracy questions, right? I don't know, Mark, if you have maybe a idea on how to answer him best, because I know there would be diagnostic test accuracy clinical answers, but how to directly identify them quickly, I'm not 100% sure.
Yeah, unfortunately, I haven't looked for those either. But I think, Andre, looking at one could also obviously look at the reviews that there may be for those. That will also help with diagnostic test accuracies. But I think if you're looking for like a sort of guidance or a protocol, I don't think that is necessarily something that Cochrane specifically does, as opposed to rather, just testing the accuracy, feasibility, etc., of one tool against another. But to have guidance as to whether or not, specific tests should be ordered and how, that may not be as well structured as I think you're looking for.
Yeah.
Okay, thank you so much.
Again, Mark, I just want to add again.
Sure.
If you look at this, Andre, so it will be a diagnosis question, right? And then you also use the PICO approach. So the P would be, who are the patients that need to undergo these investigations? And the I will then stand for the index test, right? Which you may not have that good idea about, but options of different tests. The C would be the reference standard, the gold standard for that condition. So in this way, if you tease out your question, so the O may be accuracy or, sensitivity or specificity of that particular test, or maybe acceptability, So in teasing out your question again, even though it's a different type of question and not an intervention question, it helps you to look at the various elements. And then those various elements can help you to give you ideas what to use and to search for.
Yeah,
And I agree.
the O, now the O would be D for diagnosis of interest.
Yeah.
Yeah, that's probably the best way to approach. Yeah.
Great, thanks, Andre, for that
Thanks.
question.
Yeah, thanks.
I don't see anything else coming through in the chat. But if there are still questions coming through in the meantime, I'd like to also just thank Anal again for presenting today. This was really insightful. Nice taster for those that are maybe experiencing Cochrane Library for the first time, and it really just shows, you know, the breadth of the Cochrane Library and the tools that are embedded within it that are for us to use. So, you know, that what they say, the practice makes perfect. So I encourage people to use the tools that Anala shared today and applied in your various fields of research, and, you know, dig around in the Cochrane Library. And if you do, you know, get stuck, feel free to contact us at the Cochrane South Africa, and we'll be more than willing to assist in, you know, solving any queries, any questions you may have. So thank you very much.
Thanks,
And
Amir.
I hope you guys all have a very lovely weekend. Thanks, Anal.
Thanks, everyone. Thanks for organizing it.
Thanks. Bye.
Thanks,
Bye.
everybody. Thanks, Anil. Bye.